Hello everyone, I'm Dr. Priyata and I welcome you on the behalf of platform of Mission MRCOG. Okay, so this is the task number 1 on your screen. This is from the teaching module. So now you can read your instructions. Should I change the slide?
Okay. Okay, you can change.
We all people know this. This is the first station of this Lisa Joyle's book, and so nothing new about it. So Husna, you please make your plan, and after that you can start the station. I'm giving you 2 minutes time.
Okay.
There is voice coming from somebody's side. Except Husna, please, all of you other people mute your microphones. Yeah, Husna, you can start.
Okay. Hello, I'm Husnata, one of the register, and you are?
Yeah, I'm Riya.
Okay. How are you here today?
Yeah, I'm doing well.
How is things going on in our department?
Yeah, all well. I just
Yes,
joined.
I see that. Mm-hmm.
Yes, I
Yes.
just
Yeah,
joined
I
in
see
the.
you are in our department.
Yes.
Okay. So, Raya, I see that you wrote one consent paper, which one underwent for the breech delivery. Is that right?
Yes, doctor.
Mm-hmm. So, just I want to know, have you ever done before?
Yeah, when I was in medical school, then yes, I learned so much about consent. Therefore, I thought that I have
Mm-hmm.
enough knowledge and I wrote it.
Okay. Yeah, that's great things. I appreciate your concern. It is a very good thing that you at least write a one consent paper. And what we will do today? Today I have to go through it, and we will check both together. How we can do it in the better way? Is it okay with you?
Yes.
Okay. And Raya, please don't hesitate to ask any question at any moment. We can help you. Okay, I will be
Okay.
very happy to help you in this. So,
Yes.
Raya, before going to our consent through, before that, do you have any idea that what is the valid component of that to taking the consent? Do you have any idea about it?
Yeah, I learned. I have read that, but
Mhm.
right now I don't remember.
Okay, okay, that's no problem. I will give you the link. I will give you the some topics also from where you have to read it, and I will give you the some pro forma of the consent paper. You can go through it, and it will be very helpful for you, and also know the about the valid consent. It is our some consent advice is there. Okay, so
Okay.
usually before taking the consent, Raya, some fact I have to discuss with you. Before going to take the consent, we have to know the some things prerequisite, like we have to know about the patient, And we have to know about the case. Suppose to bridge delivery, we have to know about some idea, some knowledge about the bridge. Am I clear?
Yes, yes.
Yes, yeah. So, and that also we have to know the valid component. What is the valid component? How much we have to give the information to the patient. Patient have to retain it. Patient have to understand it. Patient have to communicate with us that she knows about the pros and cons, or she had any additional concern, and patient will be willingly sign. Okay, she will be never be forced by the other person. Am I clear?
Yes.
So, can you tell me one or 2 points, Raya?
Yes. It has to be like patient mental capacity has to be checked, and also it has to be valid. That means the, and we would give information. Patient should understand it. Patient should weigh it, pros and cons, and patient can communicate the decision. On the other side, it should be given voluntarily.
Excellent, excellent. You are very quick learner, Raya. I am very happy to see you in this situation. So, Raya, now we have to come to the point that together we can see it. Never we think that it is like a blaming attitude. It is together we can do it in the better way. Okay? I see that this consent, first of all, we have to be sure the patient identity. Okay? We have to ask the patient her name, what is the age, what is the NSH number. Am I clear? So
Yes,
we
yes.
have never missed any. Yeah, we have never missed. Then first line will become that what is the name of the procedure. I see you wrote the name of the procedure in the lower segment cesarean section. Okay, and another thing that then we have to tell the benefit to the patient. What is the benefit? Benefit is the delivery by the cutting of the womb and the tummy to deliver the baby safely than the vaginal delivery. Here I see you wrote the abdomen and the uterus. Don't you think that, Raya, if we write the tummy or womb, it will become more convenient for the patient, and it is a lay term they can understand, because we are healthcare person, we can understand the medical jargon. Am I clear with you?
Yes, yes.
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 Yeah, excellent. Yes. So after then, what we have to do about the consent paper? We have to go for the give the some procedure. What type of procedure it is? We have to cut. We have to short brief to the patient that we have to give a cut in the lower tummy, around 10 to 15 centimeter, and through this we have to go to the womb, cut the womb, deliver the baby very safely, and patient to be stay in the hospital 2 to 4 days. And after the delivery, she will be maybe with drip and with antibiotic according to the protocol, and with analgesia and the thromboprophylaxis. So this one we have to tell to the patient in the late term. Am I clear with you?
Yes.
Okay. So, Raya, other things that at the same time you have to tell to the patient that there is some risks, some frequent risks which can be happen to everybody, and some serious risks. It is very rare. Okay. Frequent risks that patient can be feel the discomfort. Patient can be feel the some own infection, own gap. Sometimes there can be patient have some burning in the urine. So these risks we have to write. We cannot write all the details. We can tell the patient that it is common, but not that much. Sometimes we can give the percentage that own infection can be happen 5 in 100, own gap, own discomfort can be happen 9 in 100. 1 or 2% we have to tell. Is it okay with you?
Yes, I wrote.
But I see you wrote
Percentage.
Yes, yeah, I see. You wrote it is very good. Appreciate it is very appreciating point that you wrote almost all the things. Okay, but when we wrote in the divide way, Raya, don't you think that it is more impressive and more understandable with the patient? What do you think?
Yes, I think.
Yes. So another serious risk is the patient may have the injury to the other organ, although it is very rare, and may have the blood or hemorrhage. So we have to give the blood transfusion, and sometimes patient can be returned back to the theater, or very rarely that patient can be die. So all the information we have to be given to the patient, because we have to be truth and.
Okay. Yes.
Hello, what do you think?
Yeah. I think you're right.
Yeah.
So if I
Yes.
tell them about the death and all, so what they will be like very afraid.
No. On that time, we have to very nicely counsel to the patient that what information we are giving, it is not to make you scared, but you have to know about it. Okay? When we will be counsel the patient, and patient will not be afraid. Okay? But all the truth, we have to be careful. We have to be truth and honest to the patient. Am I clear? Yeah. So I see that you wrote the blood transfusion. It is very good. If needed the blood transfusion, we have to give. But beforehand, we have to know the what is the blood group, and she has any concern about the blood transfusion or not. Sometimes few patient can be have the Jehovah Witness. Am I clear with you?
Yes.
Yes, you are right. So next point I see there is a little gap, but don't worry. It is the first time. First effort is up to that. I am very appreciating to you. And what is the other procedure? Other means many. The blood transfusion, many. If there is organ injury, you have to repair it, or patient may go back to the theater. Okay, these things we have to write
Yes.
in the alternate. And regarding before shifting to the patient or before planning to the patient, we have to discuss with our colleague. It is called the anesthetist. So anesthetist to become here and discuss with the patient what type of anesthesia to be good for her. Is it clear with you, Rayana?
Yes, I wrote that.
Yeah, I see this one. It is also very appreciating for you. And another thing, Raya, in the complication area, few things we have to give her in the future. Like that, there can be a little injury to the baby, 1 in 2 out of 100 baby. Laceration can be happen. And in the future pregnancy, maybe need again cesarean section, or there is a possibility of the placenta can be become in the other area. It is called the placenta previa or placenta accreta. And sometimes very rarely 4 to 8 out of 1,000 baby can be have this stillbirth. So all the information we have to give through the patient. Okay.
Okay. Yes.
So Raya, yeah, Raya, I see you wrote your name. I'm very appreciating you sign it also, and there is a date mentioned. Very good, and also patient sign. Sometimes there is interpreting area you already cut down, and there is a contactable where she has to contact if she has any concern. And in the same time, you have to tell the patient that if she is not agree for the consent, anytime she can withdraw. Okay, we cannot force to the patient to go to the cesarean. Am I clear with you?
Yes. Yes.
Yes, Sarah. Raya. So Raya, do you have any questions so far?
No. So what I was thinking that mm,
Mm-hmm.
yeah. So I think I did a right job. So I keep on doing it.
You did the right job. I am not telling that you did not, but together what we will be do? Where is the just gap? I keep in the red line here. I will give you the just blank pro forma. You will be practices 2-3 times. You will be come again with me. I will see it, and then I can sign for you the format OSET. Okay. When we will see that you are more competent, then our consultant will be signed for you to sign off. No problem. There is no hesitation at all. So how the session went, Raya?
Okay. Well, your time finished.
Okay. Thank you.
So Husna, you did very well. So
Thank you.
yeah.
After long time,
Yeah.
after long time, Priyata, missing you. Hala. Thank
Yeah,
you.
you really did well.
Thank you.
And so first I'll be just giving a little bit feedback about your performance. Though you have already done well, so I've got very less to say. Later on, I will give you complete answer to this question. Fine. So,
Okay.
Husna, when you started, you just said, have you got any idea about valid consent? So, in any sort of teaching station, feedback station, ideally we have to give information first. After that, only we can ask question.
Mm.
Without telling them, we
Oh.
cannot ask questions
Mm.
because the exam, these role players, they are not medical person. So you have to give
Mm.
information, then only you can ask. This is the one point I want to tell you. Second point, when you were discussing like risk, then you have to say that we have to know we have to know this. So instead of saying we have to know, you can say What do you think, Ria? Wouldn't it be better if we mention like that? So please, if you change that terminology, that will be like good. Fine.
Okay.
And
Yes.
then in the start, so you did consent very well, and but if they have given any filled document to you, you have to go simultaneously. You have to go through that document and keep on giving feedback simultaneously. So in the starting, he wrote like patient name and date of birth. So you said that yes, you have done very right. At that time, you appreciate. Okay, that time there was no appreciation. Whatever the good they have done, you have to appreciate. You keep on appreciating all the time, but this was missed. Second, in the name of procedure, like they have written, whenever you saw that they have written LSCS, so this is an ideally an abbreviation, and according to what the RCOG say, abbreviation should not be used. So you have to say we can write like full form of it, and also indication also, in this case, so lower segment cesarean section for that would be like give more emphasis, like you are writing the full form and also giving indication, and some little bit importance about handwriting has to be given, because according to the GMC, the writing has to be clear, legible. Okay, so you have to bring this whenever you are getting any handwritten document, so you have to bring this point in the station. Yes, you have written it very well. Your writing has been the writing has been very clear. As per GMC requirement, it is has to be clear and like legible. So you have to bring that point in the picture. Then
Okay.
yeah, rest you did everything. So now I'll be giving complete answer to this. So this is feedback about you, Hosna. Anything you want to ask?
Oh. No, Dr. Priyata, just I have to know that sometimes we are asked in the background, no? So in the valid consent point, it is as a background, can I ask, or what do you think?
So, in no, see, there are two things, Husna. In background, you
Mm,
have already asked, have you got filled, have you got
mm.
filled it before? Okay. So this part you have already asked
Oh,
my background, and I said in the medical school I have read much more about it, so I know about it. So this is asking of background information. Now, whenever you are doing any teaching feedback station, you are asking me.
oh,
You started the station, any idea about valid consent? That means without giving information, you are asking my knowledge. So this part should not be done.
okay.
Am I
Okay,
clear?
now I understand. Yes, you are clear. Yes.
Yeah. So now I will give you the complete answer to this question. And let first go with this template I have designed. So first of all, you have to start with the introduction, and in all teaching and feedback station, you have to enter in the station with a big smile, because these are like these station test important domain, that is the communication with colleague. So you enter with like a very good smile, and after that, whenever the introduction is done in the teaching station, you need not to use the word doctor, but you have to just tell them, if you in the like in your question, if you're ST5, then you have to say, hello, I'm ST5 Priyata, I'm Priyata ST5, and you are. So she or he will give her name. After that, say nice to meet you, and like this type of introduction has to be done. After that, you have to check repo will be repo building, and in all these teaching station these days, like from like 2017, sometimes they include bully also, and you have to identify that, because that might not be in teaching station, it will be only bully station. So you have to once you make a repo, so you have to check bullying. So what the questions you can ask for the bullying, like how is going in the department, you recently joined Ria, so do you feel do you need help in any situation? Do you feel supported, Ria? Do you, so if you ask this type of questions, so if any bully point is there, then you will be able to identify it, because you are asking her direct questions. How is going in the department? How are you, Ria? And are you learning new things? Do you feel supported? If you ask two, three things, so that means if any bully component is there, she has to then come out with that. Okay, so which in teaching stations check this bully. Checking of the background knowledge is very important, like Husna did, and I'll be explaining the answer again. I'm just giving you this template. We need to check their background knowledge, that why they have written this consent form, and have they got any idea about it, have they seen this patient. So this type of knowledge is important, because if you have not seen that patient, like how can you write a consent form? So this type of background knowledge, and the reason why they have written, because sometimes there is a bully lie here only, that somebody has threatened them that they have to write it. Okay, they have to fill it, and they don't know, and they have got no idea, and they are writing it because somebody is threatening. So again, this in this way, if you ask a reason why they have written it, so you will again identify bullying. So this type of rapport making has to be there. Then agenda making. Okay, so so first you need to start with the introduction, then you need to make a rapport, check background knowledge and the reason why they have written, and check bully point if it is any there. By this type of rapport making, it will come out if it is a bully. Then we need to make an agenda. So agenda making for the normal teaching station and this feedback station is a little bit different. I'll be explaining that. Then you have to go the whatever the written document is there with them, keep them encouraging all the time. Okay, you have to just keep on saying keep their encouraging and check their understanding. Like you in the all stations there is a this dictum that you keep speaking only 1 minute and 1.5 minutes. After that you have to pause. You have to in the role player station you have to check understanding of the role player. In the this colleague or teaching station you have to check understanding of this thing, like your colleague. So keep encouraging and check understanding. Then you have to make a learning plan, and that learning plan or action plan has to be very clear. Then after that you have to close the station, and before closing you need to take feedback on your performance, and you have to give them feedback. Then you have to close them, and with a learning plan, with a follow-up appointment. After that, just with a very big smile, you have to say enjoy, have a lovely day. So this sort of a template is there for the feedback station. And there are pillars of feedback. I have kept this station in this class, because teaching, everybody knows teaching, and we have done so much of teaching stations. But feedback station is agenda making will be slightly different. And what is the difference? So the feedback station, there are three pillars of the feedback: what went well, what could have gone better, and then devising a learning plan. So if the feedback station is coming to you, then in that situation you have to bring this thing in the picture. Okay, so this will be like pillars of feedback. Then a possible feedback station that can come, it that your colleague has written a consent like this one. It can come as an operative note. In the exam it has come at, there had been surgical miscarriage, removal of surgical miscarriage, and your colleague has written an operative note. Now you need to give feedback. Recently MDT station has come, where MDT form was there, and they have filled it in. You have to give feedback. And the very famous station of the discharge summary. So in this type of written document can come, and you have to give feedback. So the template will be like same for all feedback station, but you have to bring this pillars in the picture. Now I'll be giving answer to this question. But though the Husna has done it very well, but still I have to give you answer. So first, now we can put this according to this template. First of all, introduction. Hello, I am Priyata, ST5, and I have to enter in the station with a big smile. Then nice to meet you. And you are, so they will say some name like Ria, and try to remember that name, because in feedback and teaching station, usually name they never write in the station. So you have to ask from them, and you need to keep on repeating that name. But if that name is difficult and you don't remember, then forget it. Okay, after that you have to make a rapport. So rapport making and checking for the bullying. So what questions we have to ask? Okay, Ria, how is going in the department? Are you enjoying here? Do you feel supported? So these are the questions for bullying. After that, asking for their background knowledge. So then you have to ask, okay, So I can see that you have filled in consent form. Yeah, that's a very great thing you have done. Okay, can you tell me that have you ever filled it before? So they will give you some answer that whether they have filled it or not. Then you have to ask, are you okay? Why you wrote it? Sometime if there had been bullying issue, somebody's threatening them, they will say, okay, he just wanted to write me, though I have no idea. So that will be like checking for bullying. Then you have to again see, are you following with this patient? So this is again comes as a part of a patient safety, because whether they know anything about this patient or not, or whether they are following with this patient or not, this will again come that they are aware of the situation of the patient, because all consent form for cesarean and breech cannot be same. They will vary from patient to patient. So these are the questions you have to ask to check about their background knowledge. First, have you written it before? Are you following with the patient, and why they wrote it? Okay. So this will be the rapport making. After that, you have to make agenda. Agenda is a little bit different. What is the agenda? Okay, Ria, you have filled in a consent form for cesarean section. So my job today will be, I will go through this filled form with you, and then I will see, we will see together what you have done well and what could have gone like. These are the pillars. Okay. So agenda will be, you have filled in a consent form, Ria. So today my job will be, I will go with you with this consent form, filled consent form, and just to find out what went well and what you really have done well, what could have gone better. Then together we'll make a learning plan. And towards the end of our session, I'll be giving you some handouts for the consent form, so you can fill it, and then anytime we can meet again. And so if you practice, keep on practicing more, then more, with the more practice you become more like more you will have a more confidence, isn't it? So she will say yes. After that, you say that, okay, how that sounds to you. She will say again, okay, thank you, doctor, or it's a very good idea. So after that, you have to now start with this, with your then now that there will be starting of the station. And in all teaching stations, all feedback station, before you start with the station, ideally we have to start with the importance of this that part, importance of that part letter, like a document. So here it is a consent. So what we have to say, okay, Ria, like so this consultant, so you have to say something about this importance of this consent form. So Ria, this being a medical legal important, see, and it is really important document, because if like the patient is not happy with the care, so in case of litigation, it will be, it has got a very great value as being a medical legal document. One. Second, Ria, according to the GMC, GMC guidelines says that it has to be filled by the doctor who is going to do the operation, or the person who has trained enough to take consent for that particular procedure. And as you and as you have written it very well, but according to the GMC, ideally a full form should be written. We should not write abbreviation, and the writing has to be clear and legible. So you have to give this your younger junior colleague idea what is the importance of the consent form. So then he or she will realize, okay, so this carries so much of importance, because he just filled it because he had some idea. So unless you give him or her complete knowledge of the importance of that particular paper, then they will keep on doing it, and this will be like hamper patient safety. And this, the part 3 exam is total, though it is a domain based exam, but there is have been too much like emphasis on the patient safety. So you have to put your in your station all important things that are important for the patient safety. Okay, so this is again a domain for the patient safety. After that, now before you go start with this any document, you have to say, okay, Ria, let's go through the consent form you have filled in. Okay, Ria, so what do you, how do you, you have written a consent form. I do appreciate it. How do you feel about it? Do you find that some areas were difficult? So if in their mark sheet they have got some like marks are for asking some questions they will ask, because directly you are asking their problem. Okay, how do you feel about it? Do you find that there had been any area that were difficult to you? So she might say something, okay doctor, I didn't know what to write in others procedure. So they will like this will be more rapport making with them, more involvement of your colleague in the station with you, and also it will give you if the marks are there for this, then you will get marks. Okay, after that, now let's go through it. Okay Ria, you have now they have written this name. Okay Ria, I can see you have written you have put this sticker, or you have written the name Samantha Brown and also the date of birth. That is a very nice thing you have done, Ria, because Ria, it is right patient, it will just give you mark for the patient safety, because it's the right patient and right consent. So this is the checking for the patient identification, and this will come in the patient safety domain. So it's a very good thing that you have done it. So because they have identified the patient. Now coming to the name of procedure, yeah Ria, I can see you have wrote the name of procedure LACS. That is a really good thing you have done. Won't you think, Ria, if we could write like full form, lower segment, cesarean section, and also we know the breech indication, wouldn't it be better if we write lower segment cesarean section for breech? Wouldn't it give more information to the patient? Then she will say, yes, doctor. After that, I can see that you have explained the procedure to the patient. So I can see that you have done it. So in particular, like what we do, we just explain the type of cut they will be having on the type of cut, and a little bit about post-op stay, and also what they expect after the post-op during post-op period. So this is sort of explanation to the patient, and I can see that you have there had been a mark that you have explained this procedure to this patient. That is again a very good thing. Now again the consent, like I can see that you have wrote a written benefit, that is to deliver a baby safely through a cut in your abdomen and uterus. So very this being a very good thing, Ria, you have wrote everything. But ideally this consent, one copy of this consent goes to patient. So avoiding medical term and jargon, just using patient friendly term, wouldn't it be better? Like we can use womb. So she will say yes, doctor. Okay. So now, yeah, Ria, I can see that you have wrote very nicely wrote this risk. This is a serious and frequent risk. So okay. So you have written this hemorrhage, and also clot. Clot you wrote Ria 1%. Infection, injury to bladder, bowel. You wrote this as a low risk. Yeah, good. You have written it. Hysterectomy, you have written it. And also cut to the baby, you wrote as a rare risk. So good. You have wrote all the risk. So Ria, have you right now? So from where you have you wrote this? She will say something, or you can say. See, there is a RCOG consent advice about a cesarean section. Have you been through that? She will say no. Then in that situation, you are just giving more advice from where to read about it. So in that, and she has written some of this risk. These are not like she is not in a correct manner. So you have to say serious risk, yes. Blood clot being a serious risk, Ria, and you wrote it. That is a very nice thing, but it is not 1%. It is like 4 to 16 per in 1 10,000. So this is like quite high number you wrote it. It is not 1%. It is 4 to 6 in 10,000, isn't it? Am I clear? So she will say yes. Then also injury to bladder and the bowel is it is not a very low risk. It is 1 in 1,000. So is it okay? Because what it has been what it given in the consent form. Okay, so she will say yes, and also frequent risk, like you have wrote hemorrhage, that is a very good thing. So other and infection, so you have put them together. Either we can just write them differently as a series, and the frequent risk. Wouldn't it be more better for the understanding of the patient? Then she will say yes. In frequent will be infection and hemorrhage, and also you wrote this cut to the baby as a rare. Yeah, Ria, that I appreciate that you have mentioned this risk, but on the other side, Ria, cut to the baby will be like it comes under the frequent risk heading, and it is 1 to 2 per 100. am I clear? She will say yes, because you have explained that. After that, as Husna said also, we have to explain them risk of with all the surgeries, though we take all the precautions to make them safe, but in spite of all, there had been a risk of death, and we have to explain in a non-scary way. So isn't it? Then she will say yes. So how we can do it? Like if we can explain this to a woman, if the 12,000 women will go for an cesarean section, then as a direct complication, there could be one woman may lose her life. So isn't it? So in the non-scary way, we have to explain it. So she will be like, oh, okay, am I clear? Wouldn't it be better that patient should know about it? Then she will ask, should we say all these things, because patient will be afraid, or they will be in that situation. The answer to that question, so this Ria, whenever we are filling in this consent form, and this is the GMC guideline also, that patient, we should give all risk of complete idea of the risk that can happen to a surgery to the patient, because so that the patient will be in a position to take right decision for herself. Because it is like consent, it is an agreement between doctor and the person who is taking consent and the patient. It is not any sort of bonding. So she will understand, okay, that we need to explain this as well. After that, yeah, I can see very well you have wrote the blood transfusion. That is very good. Ideally, we just ask them about the objection. So she will say yes or no. Then you have to explain them. Then the other procedure, like other procedure would be Ria, if there had been any operation, there could be injury to bowel, bladder, and the blood vessels. So if that happened, we need to repair them, and the patient should be aware of that there we should also write repair to the damaged organ, and also risk of losing womb. So you have wrote this hysterectomy here, but this hysterectomy or the risk of losing womb will come and this other type of procedure. Okay, wouldn't it be better if we write all in details, like repair to damaged organ or risk of removal of womb? So wouldn't it be better? So she will say yes, yes, it will be better. Then after that, I can see that you have take the explained the patient about the regional and general anesthesia. That is a very good thing. I can see. And then also you have put your you have signed it, you have printed your name, you have wrote the name, you have wrote the date and the job title. This is a very good thing you have done. I appreciate it. And also you have wrote the contact detail. That is a very good thing you have done. And also you have this circle, the top copy accepted by the patient. So this is again a very good thing you have done. So after that, you have to say, so Ria, let me take you through. So how, now, at that time, this time, you can say, so how you feel about this, Ria, right now? How do you feel about the session? So she will say, yes, excellent, doctor. That means you are taking feedback about her performance. And also, you can say, okay, Ria, I find you are very enthusiastic and a quick learner. So this is sort of feedback you have to, either you can take and give feedback towards the end of the session, or you can do it right now, because there had been one more task here. Where the task on? Okay, this is the task. You have to explain principle of valid consent. So after now the feedback part has been done. So you have given this junior doctor feedback. Now you have to take through the valid consent. So let me take you through the principle of the valid consent, Ria. So ideally the patient should have capacity, and how we judge a capacity, that patient should understand what the information we are giving. Patient can weigh up the pros and cons of that. Patient can then communicate our decision. Then they can communicate their decision, and also it has to be voluntarily. And on the other side, Ria, uh, if the patient is fully informed, that means patient should be aware of benefits, patient should be aware of risk, patient should be aware of the alternate and the implication of not having it. So these are the am I clear about it? So these are the key principle of valid consent. Can you repeat it for me, so that I am able to understand that you are able to understand? Otherwise, I can repeat it for you. So she will repeat something. After that feedback has already been done, then you need to end the close the station. Okay, so Ria, as you are a quick learner, and this so now I'll be giving you handouts, so you can fill in some consent forms. And anytime if you because if you fill it more, then you will be more confident, and you can come back to me anytime. I'll be there. So I'll go through that again, or I'll check that again. And on the other side, Ria, so for your further learning, there had been a consent tutorial on the strategy, and I will give you a handout for this clinical governance advice about the obtaining valid consent and the consent from for the cesarean section. So that you can review them, then you will have a much better idea about it. How do you feel about it? So she will say, okay, doctor. After that, you have to this close this station and just saying any questions, then you have to answer. Otherwise, you have to say, okay, enjoy, come and have a lovely day. So this is all about this feedback stations, where you have done all the time. You explain what went well. Every time you have said, okay, wouldn't it be better? So you have explained, done in the station what could have gone better, and towards the end, you have given her a learning plan that from where she can further learn, and you have given her a follow-up appointment. So that's all about feedback station. So anyone, if have got any question, can ask me. Any question?
No, Priyata, thank you. Thank